Now we'll be talking about injection adenosine. Now adenosine is one of the most important injection that is used in ICU almost always for paroxysmal supraventricular tachycardia. Now there are few things that we must know that it is given very rapidly and it is given over a period of 1 to 3 seconds. If it is not given this much fast, then this injection is totally useless or it will not help. It has to be given by the very much proximal vein towards the heart. So best is central line, but if the patient has no central line, then the intracath which has placed as near as heart, that is through elbow, it can be given. But it should not be given by an intracath which is placed at wrist or forearm because it will take more time for the drug to reach the heart. Till that period, the drug will be rendered useless. So the activity of this adenosine, it gets terminated within 30 seconds. And how does it actually act, or why it is so much effective? It acts at SA node, AV node, and atrium as well. So at SA node, it significantly depresses the pacemaker cells. So it reduces the automaticity. It causes prolongation of refractive potential at AV node. So it causes slowing of the conduction at this AV node. That is very important aspect for almost all the paroxysmal supraventricular tachycardia, which actually involves the AV node, which mainly involves AV-NRT, AV-RT. At atrium, it shortens the action potential duration, so it definitely reduces the excitability. So generation of newer rhythms can be significantly reduced. And as I told, that it acts at AV node by reducing the calcium currents which are coming at AV node. So it markedly reduces or depresses the re-entry circuits through this AV node, and that is how it simply terminates the paroxysmal supraventricular tachycardia. So this is the pathway, or this is the location where it actually has extreme effectiveness in terminating the AVNRT, AVRT, SVT. Apart from that, it has a very short half-life. It has short life of only 10 minutes. So the duration of action of this drug gets completely over within 1 minute. So the complete elimination of this drug occurs even in a single passage of this drug through the coronary circulation. So once this drug is given IV, once it passes through the heart, through the coronaries, the drug is over. The drug is no more. So the effect is very short. It is less than 1 minute. That is the reason even if the patient has adverse effect like cardiac arrest, it is still totally temporary and transient, and patient will revive on its own within a period of a minute. One more important and interesting thing is it does not cause hemodynamic deterioration. See, we are talking about PSVT or VT. So what are the other choices? The other choices are dilzem, that is diltiazem, verapamil, and Cardron. All these three medicines can significantly cause hypotension. That is the reason why they have to be used very cautiously whenever there is this hemodynamic compromise or hemodynamic deterioration. That is the reason why adenosine is safe even in presence of hypotension, even in presence of congestive heart failure, whereas this diltiazem and cardano, they are not safe. This adenosine is safe even in presence of wide cortex complex tachycardia, whereas this diltiazem or verapamil is not. Because again, whenever we're having this QRS complex tachycardia, we'll be always thinking of the amiodarone, diltiazem, and adenosine. So that is the reason why adenosine is a safer choice whenever we are talking about wide QRS complex tachycardia. Many of the times, as we know, this duration of action is only 1 minute. And if the patient has this tachycardia, if we want to block this AV node, we can give this adenosine to see what is the underlying pathology. Because many of the times, when our patient has SVT or SVT or any tachyarrhythmia, you may not actually understand the underlying aberrancy. The patient may have WPW syndrome, but it may not be apparent when the patient has SVT. So you just give adenosine, the patient will revert back to the normal pathway, or the it will revert back to the normal heart rate, and that time you may be able to see this WPW syndrome as the underlying pathology. So it can unmask the underlying rhythm and abnormality, and as it has very short duration of action, only the effect only lasts for less than a minute, so even it is much safer. What is the dose? The dose is always, to start with, is 6 milligram IV given rapidly over 1 to 3 seconds. If it fails to revert, maybe after 3 to 5 minutes, a 12 milligram of this same dose can be given. If it fails after again 3 to 5 minutes, 12 milligram can be given by rapid IV bolus. If this still fails, then the other drugs can be taken into consideration. Injection diltiazem 5 to 20 milligram can be given slowly over a period of 2 to 3 minutes, and Cardron 150 milligram, it can be given IV bolus if the blood pressure is stable, or it can be diluted in 100 ml NS, and it can be given over a period of 30 to 10 to 30 minutes. So this adenosine, where do we use? It's very important. It is used for paroxysmal supraventricular tachycardia, tachycardias of AV node, especially AVNRT, AVRT, for diagnosing many of the tachyarrhythmias of AV node. We can use this adenosine, and this can be definitely considered whenever the patient has hypotension, congestive heart failure, or white QRS complex, where using diltiazem and amidron can be risky, can be contraindicated, can be cautious. So this is all about injection adenosine.